So I have a question for you guys as far as finding proximal surfaces. Who has ever had an issue with trying to find the right angulation? In this video, I'm going to show you how to find that actual point where you're supposed to measure. This is a great view, which is the proximal view. In my previous video, I went over buccolingual surfaces and not really a 3D image of the proximal side. So in order to go in and see the CEJ, I really want to, or the base of the pocket, I really want to go at an angulation, especially when it's a proximal surface. It's going to have another tooth beside it. So imagine there's two teeth right next to each other and I'm probing right here. So when I measure, I want to be at an angulation. I don't want to be at this kind of measurement here where the X is saying no. That is where you're not supposed to be probing. As far as if you're trying to do the mesial distal or proximal surfaces, you should be at an angle like this. And the reason why is because you're trying to get that most of the pocket depth from the proximal area. And when it comes to FG margin, it's the same thing. You want to make sure you measure the CEJ accurately too. So when you go in here, you're measuring the CEJ, you're feeling for that CEJ, and then you're going up to measure the free gingival margin in comparison to the CEJ. If the free gingival margin lies above the CEJ, then you are going to get a plus number. So in this case, it's a +4. And also, since the base of the pocket is right at the CEJ, it's going to be a +4 for your probing depth too. So it is the same number for both measurements. So if we're doing the calculation and you want to see a little bit of math, I'm happy to do that. So it's probing depth minus, this is the equation. Usually it's probing depth minus the FG margin, and that will give you your CAL. So we said it's a 4 for the probing depth minus the +4 for the the FG margin. So 4 as well. And that will give us a 4 minus 4, 0. So this makes sense because we're looking at no attachment loss. We are looking at a healthy patient. If the periodontium was, the free gingival margin was below, we would have some kind of attachment loss. But in this case, it's the same measurement as our junctional epithelium. The junctional epithelium, which is the base of the pocket, and the CEJ are lying next to each other. And that means that there is no attachment loss. It's an intact periodontium. And this is very important, especially with the new AAP guidelines. We want to measure the attachment loss, and we want to measure all the FG margins accurately so we can stage and grade based on these attachment levels. Obviously, in this patient, it's a healthy periodontium. It's intact. It's only one tooth that I'm looking at, but in general, when we're looking at teeth that are like this and say the whole mouth has no attachment loss, we are looking at a healthy patient with intact periodontium is how we would state it in our diagnosis. So whether it's periodontal disease or not, or healthy patients or not, the same concept lies when we're measuring both PD and FG margin and then calculating our CAL. I hope this helps. Good luck and have a great day.